So it has been agreed, it's been decided that 1st of June schools are reopening. Of course, it's always been said that that is for grades 7 and 10. The minister at pains, though, to say that especially when it comes to the smaller schools, then they can't really dictate as to whether or not they're open. But a plan has to be in place. So just to at least run through one of the major things coming out of that press briefing, the scientific evidence on which the decision would be based. This is something that parents and unions alike have always been emphasizing. What is it based on? The Director General saying that this has been based on not only advice from local but international experts, but they are using international best practice from countries that have reopened schools in Europe and Asia, and saying that they can only draw lessons from those countries that have done this, and saying that there is emerging research that is growing vast, more vast by the day. But what this has created is that it's also created a sense of confusion, because depending on the prism from which you look at the problem, you would then apply it to whether or not you ought to open schools. Lots of concerns that are coming out of this, whether or not children will be protected. The minister did speak about comorbidities, for instance, saying, and I want to read this for you, what she was saying, how they're going to protect school children, especially parents, saying that, you know, they must get thorough reports from parents alike as well as learners on whether or not there are underlying health problems. Questions are being raised about the asymptomatic manner of those who may be who aren't showing any signs of COVID-19. The minister earlier on saying that there's been no evidence of anybody who has died from COVID-19, especially within the ages of 0 to 9 years old. Is this the model that the department is using to justify reopening of schools? This is what some people are asking. Well, let's get straight into the conversation. As I said, lots of questions being asked. Have they been answered, especially as the unions were asking for specificities on certain things? Dr. Nick Spoor is a senior researcher at Research on Socio-Economy Policy at Stellenbosch University, joining us via Skype. As you can see him there. And Motshekga Brody is a legal researcher, Education Rights Program at Section 27, joins us on the line. A very good evening to you both. Thank you so much for speaking to us.
Yes, thanks for having me.
Dr. Spoor, let me start with you. So experts have been calling on the department to release the data it's using to decide on which and when schools will reopen. One of the things that the minister was saying, that there has been an agreement, for instance, that all provinces must progress in tandem, that the CEM has agreed that provinces must move at the same pace to ensure that nobody is left behind. So those, to me, I would say are two very different trains of thought. So to say all provinces must open in tandem, but that they must progress equally, it's a misnomer, isn't it? Because we all know that not all schools are the same, whether in resources, state of readiness, and whether or not they will, especially individually, feel that they're ready to open from grade 7 to 12 or all schools.
So I think that what the minister showed tonight was leadership, that this is a very difficult time. There are lots of uncertainties, but it was clear from what she was saying that they're being led by the evidence. So she said that she's listening to experts, listening to evidence, that this is in accordance with what Prof. Karim and the rest of the medical advisory council are recommending. I found it to be humble, honest, reasonable, scientific. And I didn't actually find that statement around provinces to be contradictory. I think what she was saying is that we can't hold up the whole country for a small number of schools that aren't yet prepared, and that the department needs to do as much as it can to make sure that those schools do get prepared, but that there are millions of children that need to go back to school because, in her words, schools are good for children, schools give children structure, and we really need to get them.
No, she absolutely did say that, for instance, the question was asked whether or not parents who are not ready, according to their own levels of anxiety, to allow children to go back to school, whether or not they can ask for children to be held back, repeat a subject. And she said yes. But we spoke to Satu and Naptosa, for instance, yesterday, and Naptosa saying as of yesterday, 80% of the schools that they've been in contact with, there are no signs of readiness to the level that they can open on the 1st of June. Is there a difference of information that is filtering through?
So I think what the minister did say around that was when she was asked, can you guarantee that there will be no infections? And she was very frank about this, where she said, no, we cannot guarantee this. And unfortunately, with this pandemic, we're not in a position to be able to guarantee those sorts of things. So I think that the department needs to provide, in the minister's word, reasonable precautions and to make sure that the PPE does exist at school, that there is water for children and teachers to wash their hands, and that reasonable precautions have been taken to make sure that the schools are safe. But it's simply not feasible to keep children locked up at home, and that this policy is actually incurring lots of costs, particularly for young children in poor context. And I think that the minister acknowledged that and said that we need to find ways of getting schools back together, back to work safely. And yeah, I think that she did a really good job.
Okay. Let me just ask you this one question before we go to our other interviewee. I want to use the international best practice which the department is pointing to, and there's the issue of France. We understand that there have been 70 infections being reported at a school that's opened for a week, and it's not really clear who may have affected whom. In Germany, there is the issue of teachers who were found to be positive, although schools weren't forced to shut down there. So it goes back to the issue of the concerns that have been raised, especially around Kawasaki disease, which has been found in Europe, especially in the United States. We've seen some fatalities as a result of that, which is what is making teachers anxious. I mean, parents anxious. Rightfully so. The minister says they can't guarantee this. But with all of these things in play, should parents just take heed that the best can and has been done, and therefore children should go back to school?
Sure. So I think one thing that's useful to say to parents is that the virus does not affect children in the same way that it affects adults. This is something that the medical experts are explaining and have explained to the ministry, that children very rarely get severely ill from COVID, which is not the same as adults. And they almost never die. It is extremely, extremely rare for children to die from COVID-19. You mentioned the Kawasaki illness. This is an extremely, extremely rare illness. So in New York, where there was 100 cases, there are more than 2 million children. So this is an extremely, extremely rare thing. And there are many more instances of other diseases that we don't close down schools. So the last thing that I think is worth mentioning is that children will catch this disease at school. Some teachers will catch this disease at school. It's not a case of if they will get it, it's when. Not all, and most children will have no symptoms at all. Most children have only mild symptoms and don't get severely ill at all. But they're going to get infected either way. Not all children, but some. And if we accept that now, that is, we put precautions in place, if we make sure that they get the medical treatment that they need, and that this is a very, very small percentage of children that will get it, 0.02% of children in the US were part of that severely infected range. So this is a really small percentage, and I think that's what we need to emphasize to parents.
Motshekga Brody is legal researcher, education rights program at Section 27. Are you quite satisfied with the detail and the plans that have been announced by the minister, especially the state of readiness?
Thank you for having us, Tipiso. I think we all recognize that this is a very difficult situation that the Department of Basic Education needs to navigate through. And our thoughts was that this was generally a very useful briefing, but we still need more detail, and we look forward to liaising with the department over the next few weeks. Look, I think one thing that's of concern to us, and this is something that the minister made mention of during her presentation, was that she met with the MECs from the 9 provinces, and there have been reports that have been presented to her that there's good progress that's going on in the various provinces. Now, we would like these reports to be made public, because from our own data, we've seen that many schools are simply not ready to be opened. We've been liaising with schools, client schools of ours in Limpopo, and many of these schools are reporting that sanitation facilities are still in disarray. There's still no PPE that's delivered. And so, the minister spoke about a just-in-time approach, that these things will be delivered just in time. And this is very concerning, because what happens if schools are simply not ready by that point? So there's a few other things that the minister didn't speak to that we think are quite important.
So let's talk about that, Mr. Brody. She spoke about the 1,577 schools that have been vandalized, and as a result, it's impossible to do bulk delivery of PPEs, sanitizers, etc. And the question was asked that even though these things are at warehouses, or the implication thereof is that they are, what guarantee is there that they will reach the schools in time? The minister said that schools have been cleaned. We hear from principals that not all of them have had access to schools, so therefore schools cannot have been cleaned. Some schools are infrastructurally not ready for them to be cleaned and clean for learners to come back to school.
Absolutely. And, this is precisely where we need more transparency. The minister spoke of a committee that's going to be monitoring the delivery of sanitation resources and PPE, etc., that will be made up of auditors, and that will be made up of and a call center of sorts that will be set up. And we need transparency so the public will knows what's going on. From our own experience of monitoring and evaluation of sanitation in Limpopo, for instance, we know that this is an extremely difficult task, which requires a lot of effort and a lot of time. And so the minister really needs to take us into her confidence about what the progress is on delivering these necessities to these schools.
Okay. Now, I want to talk about another issue that she raised, the re-engineering of the school sector. So there is the school management teams on whom she said they will rely very heavily on to take overall control over this. Are all schools ably capacitated in terms of, do they have personnel to have effective school management teams? And also, secondly, the minister spoke about the fact that even if you are not a grade 7 or grade 12 teacher, you must go back to school. Is it clear how this is going to be managed, and who must go to school to help?
This is something that's quite concerning. The capacity of school management teams is really going to be tested now. And whether the school management teams really do have this capacity to execute this momentous duty is going to be proven over the next few weeks. And, it's a bit of a concern, because even with the previous deadlines that have been set by the department, SMTs were supposed to have been back at schools or working a week ago, but there was simply no delivery on time, and therefore SMTs couldn't, go back to school. So deadlines have already been sort of missed, and we're worried about the department being able to meet the deadlines that it's setting now moving forward.
Thank you so much for speaking to us. From Section 27, that there is Motshekga Brody. Earlier on, we're also speaking to Dr. Nick Spoor of Stellenbosch University. As you heard earlier on from the Minister of Education, this is a schooling crisis that's been precipitated by a public health crisis. Let's go now to a virtual media briefing with the Health Minister, Dr. Zweli Mkhize, who no doubt will reflect on this.